Hello friends, good morning. Now again this is Dr. Sharjil. I'm a gynecologist and today I'm talking about a very important topic of menstrual problems in teenage girls. So let's first understand what is teenage, what is the period of this teenage. So friends, this period, this teenage is also called as puberty. So this puberty in girls, it is the period which links childhood to adulthood. So it is the period of gradual development of secondary sexual characters, means breast, height, hair, pubic and axillary hair, all these. Okay. So now let's see what are the important changes that occur in teenager girls. So basically friends, there are 5 important physical changes. Okay. First, breast, pubic hair, axillary hair, growth spurt, growth in height and menstruation. Okay. And now let's talk about what are the common problems of menstruation in teenage girls. Okay, so what type of abnormality a girl can face during her teenage period? So if we talk about the periods, menses can be heavy, can be irregular, it can be scanty. Okay, so heavy are 2 types. Mild type of heavy means less heavy, and one is more heavy. Okay, so it's very heavy, then definitely you have to consult to your gynecologist and you have to take treatment for that. But friends, if periods are, if menarche starts, like suppose a girl means it can be started from 11 years, 12 years, 13 years, 14 years. Okay, so suppose if your period starts on 11 years of your age, so this is called as menarche. Okay, so when the first period starts, that is called as menarche. So friends, once period starts, then in many cases there may be some problems in her periods. The girl may face certain problems in her periods. So in that case, the most important thing is that mother is very much anxious that my child's period is not proper, she's having very less period, or sometimes they complain that she has very much irregular periods, means periods come in 2 or 3 months interval, or sometimes periods are heavy. Okay, I'm repeating again that if periods are very heavy, then definitely you have to consult to your gynecologist. Okay, so let's first come on the topic that what may be the causes of irregular periods. Okay, so one very important thing is that in teenage girls there are certain circuits in their body. So one is hypothalamus, that is in their brain. The others is pituitary, and another one is ovary. Okay, so in teenage girls, this hypothalamus, pituitary and ovary, these are not mature enough to secrete proper amount of hormones. Okay, so there is immature access or immature development of hypothalamus, pituitary, ovarian axis. Okay, so hormonal secretion, that is basically estrogen and progesterone, is not proper. So this may cause irregularity or scanty or heaviness in the period. Okay, and but it's not the thing that every time this may be the cause. Sometimes other causes are there as well. like if there is thyroid problem, if they have got certain blood disorders, if they have got certain tumors. Okay, but these are very rare situations, not very rare, but yeah, these are rare situations. Okay, and sometimes definitely we cannot rule out pregnancy. But friends, especially to those mothers who are very much worried, let me first explain you that once your child is growing older and now her periods have been started, or you can see the changes in her body, in her physical appearance, then it's my suggestions to all moms that please give sex education to your child. Don't hesitate in this. Okay, you explain all the things, all the pros and cons of doing sex during this period, what problems they can face if they'll do sex in this period. You have to explain to your child. Okay, because now she is developing changes in her body. Okay, hair growth, pubic hair growth, axillary hair growth, breast development, and menses. So she is very much confused. Okay, so you have to explain each and everything to your child time to time, so that she should know all the pros and cons of doing anything wrong. Okay, don't scold your child, don't abuse your child, never do this. You explain all the things. Okay, now come to the topic. So once friends, if your girl child is facing problem in her period, then patients come to me, especially moms come to me, and they are very much worried that my child is facing problem. So I generally give assurance to the mother that please don't worry, because this may happen with many girls, and this is a normal process. So you don't have to create any type of panic. Just be cool enough to deal with this problem. Okay, you have to be with your child. This is the period where your child needs your most of your support. This time your child needs, so you have to be with your child. Okay, now let me tell you, if you are very much worried, and then I'll say you just go for some simple test if you are very much worried. Otherwise, leave it. If period is not troublesome, like it's not very heavy, then just wait and watch for few months, few years, because your child is growing and there are changes in her body, hormonal changes are as well. So let her access to be complete. Like I told you about pituitary, hypothalamus, pituitary, ovarian axis. So let it be mature. So it will take some time, few years. But still, if you are very much worried, then I'll tell you, just go for simple tests like thyroid. Go for her thyroid checkup, for some blood test, and simply one ultrasound. That is enough. If everything is okay, then just don't worry for anything, and just wait and watch for a few years. Definitely you have to consult to your gynecologist. I'm not saying that you should not consult, but don't create panic. Just consult to your gynecologist, and I'm sure she will tell you that just don't worry. So if she's saying don't worry, then you don't have to worry. Okay, so now if suppose if there is any problem in your blood test or thyroid or ultrasound, then definitely these things should be treated. Okay, if thyroid problem is there, so this thyroid problem may cause irregularity or some disturbance in periods. So once this thyroid is corrected, then her period will be regularized. Or suppose if there are some blood related problem, then definitely it should be treated. And if something is found in the ultrasound, then yes, if it can be treated, then definitely your gynecologist will start treatment. But usually most of the time they won't give any medicine or just symptomatic medicines. Okay, if periods are heavy, then definitely some symptomatic medicines they will give it to you. What medicines they can give? Progesterones. They can put you on progesterone for few cycles, 21 days, then again 1 week off, then again for 21 days. So few cycles, like 4 to 6 of your menstrual cycles. And most of the time this will regularize your period. And if thyroid is there, definitely thyroid should be treated. And if any other problem is there, then definitely that should be treated. But these things are rare. So I presented this video to you because I want to tell you that most of the time means in 70 to 80% cases, there are no problem to your child. There is nothing to your child. It's normal for this age. Okay, so once she will attain her teenage and she'll go towards her adulthood, then definitely her periods will get regularized and normal. So don't create panic. Just be assured that there won't be any problem. Okay, and if it is very much troublesome, then definitely you have to consult your gynecologist. And if period is not proper even after 17-18 years, then definitely you should consult your gynecologist. Okay friends, so I hope this video is very helpful to you, because this teenage menstrual problem is really very great problem, I think, where mother as well as child is very much worried. So I think this video is helpful to you. So now if you find it helpful, then please subscribe to my video so that I can continue telling my advices to you as a doctor. Okay, so friends, please like and subscribe to my channel. Okay, and if there are any queries, then please write to me and I'll definitely answer your queries. And if there is any language problem, like if you want my video in Hindi as well, then definitely I'll give this in Hindi also. So if any type of queries are there, or if you want my video on certain special topics, then please write it to me and I'll bring forward with that video. Okay friends, thank you. Bye bye.